Good evening, good afternoon, wherever you are. My name is Josephine Bowley, and I'm a public health consultant, a public health programs coordinator, and I am also an educator for public health. Today, I want to talk to you about this decision of should I or should I not take the COVID 19 vaccine. And I'll tell you, it has been written, whether by the Centers for Disease Control or the World Health Organization, that it is totally your choice to take the COVID 19 vaccine. It is not mandatory for you to take it. It is not being mandated for you to take it. It is a choice. So you as an individual have a choice to make whether you will take this vaccine or you would refrain from taking the vaccine. Now let's weigh some of the pros and cons of this vaccine. This vaccine had been approved for an emergency use authorization by the U.S. Food and Drug Administration. It has not been approved. It is not, both of them, both Pfizer and Moderna, they are not approved vaccine to prevent COVID 19. Number one, this vaccine has not been out for long. It has not been tested over time to see how it reacts with different people. So it is still in the stages of clinical trials. But we understand that in a pandemic, there is an emergency authorization for people to receive this vaccine. This vaccine this vaccine is new and it's a viral vector vaccine, and it does use the mRNA, which is a messenger ribonucleic acid, which teaches your cells how to make a protein to fight against the coronavirus. Okay, so some of the things you need to know is that, number one, this is new. It has not been tested. So if you are making that decision to go ahead and get this vaccine, it is totally your choice, and the companies are not responsible for what response you get from taking this vaccine. Okay? Though we know some of the side effects that have generated from the COVID 19 vaccine, for those that take it, is the spot of the vaccine could be swollen. Okay, you could feel tired, weak. So there are all these different side effects to taking the COVID 19 vaccine, and similar side effects exist for other vaccines. Okay, some of the things you need to know is that this virus vector vaccine cannot cause an infection with COVID 19 or with the virus used as the vaccine vector. Okay, so it cannot. It cannot. So I just want you to have this information. Although there are so many reports about different side effects, and I believe the companies that are offering this virus, they do have programs that you can give your feedback on the different side effects that you are experiencing for those that have taken this vaccine. There are some people that report headaches, nausea, whatever it is. If you have extreme allergic reaction, it is so important that you let your healthcare provider know before you engage in taking this vaccine. All right. So the vaccine is currently available, but it is totally your choice whether you decide to take it or not to take it. Okay. What other questions may be out there? You will be questioned. If you are, a lot of times these vaccines are from 16 or 18, Moderna, 16 for Pfizer, to take the vaccine, right? So this is totally your choice. I know there are a lot of information out there about these vaccines, a lot of stories that are coming about whether should you take or not take this vaccine. So for me, I would say to you, from my perspective, as a Christian woman, I would say pray about it, seek the face of God concerning this vaccine. Okay? And if the Lord gives you that peace, or he speaks to you to go and get this vaccine, go ahead. If the Lord say you should not take it, then you don't have to take it. Okay, but the least thing is that you don't want to be ignorant towards the pros and cons of this vicing. Some of the cons of this vicing is that it has not been tested. It has not been around for a while. They don't know all of the side effects that it could possibly cause in a person. All right? They don't know. So if you are taking it, that's fine. You're going to say, you know what, I'm going to try this. I have taken Vicing before, and you know, I feel in my heart and in my spirit that this is going to be okay, and I'm going to take it. All right, so make an informed decision. Follow my other videos and get informed about these Vicings and what they could possibly do, what are they, what's in them, and make an informed decision, okay, and do what is right for you and your family. Okay, so once again, my name is Josephine Bole, public health consultant, program coordinator, and a health educator. So I'm glad to be sharing these with you. See you again in my next video.